It's one of the most common reasons people visit the doctor: back pain. 80% will suffer some form of back pain throughout their lifetime, reports the National Institutes of Health. This pain can range from a dull, constant ache to a sudden, sharp pain. It can last a few days, months, or even years. The source of back pain is often an injury or degeneration. But whatever the cause, one thing is clear: suffering with a back problem can impact every area of your life. When Joe Vitale started feeling numbness and tingling in his legs, he knew something was wrong.
When the numbness set in, there was no pain involved with it. It created an imbalance. I had a very difficult time walking. As a matter of fact, when I walked into Dr. Rao's office the first time, I could not walk without a walker. It was very frightening to think that I might not golf again, as bad as I am, that I might not be swimming again, I might not be able to be at the health club each day. Yes, it was very frightening.
Joe had a thoracic disc herniation. The discs are like sponges between the vertebrae in the mid-back. And one of these sponges had popped out of position and was pinching his spinal cord and all the nerve signals that travel behind the vertebrae. As a result, his legs weren't working the way they were supposed to work, and his brain didn't know exactly where his legs were in time and space.
For Joe and many others, nerve damage resulting from problems with the discs in the neck or back puts incredible stress on their physical health, job performance, and relationships. Today, there are a number of effective non-operative and operative treatment options that truly get to the root of the condition.
Effective non-operative options for low back pain include physical therapy of various types, medication management, including anti-inflammatories, pain medications, neuropathic agents. It also may include acupuncture, even pain psychology for patients typically who have chronic symptoms, as well as injections of various types, including epidural steroid injections and other various options depending on what the pathologic process is that the patient is experiencing.
Because the neck and back are such a vital and complex part of the body, spine care has become an important component of the medical field. Spine care specialists include orthopedic surgeons, neurosurgeons, anesthesiologists, physiatrists, radiologists, and many others, all of whom are dedicated to alleviating their patients' pain and helping them reclaim their lives.
For me, one of the most common causes of low back pain that I encounter is pregnancy-related low back pain. And typically the patient will present in her second trimester. That's the most common time, usually when her body is starting to change from a biomechanical perspective. Pregnancy-related low back pain is a very significant problem. It's very common, yet it's often not addressed. So for pregnant women who don't seek treatment, for some of them the pain is self-limited. So once they actually deliver, their pain will go away. But for women who actually have moderate to severe pain during their pregnancy related to their low back, those are the women that typically end up having chronic long-term problems. I think that a common myth is that women who are pregnant cannot undergo the same types of treatment that non-pregnant patients with low back pain have. And actually, we can provide physical therapy treatment for pregnant women in a very similar way that we prescribe it for other patients who aren't pregnant who have low back pain.
Through thoughtful evaluation, spine care specialists can determine the cause of pain and develop a treatment plan for each individual patient.
I think it's important for patients to be educated in their diagnosis and treatment. One way to get educated is to go on the internet. There's a great deal of information that people can find about their problems on the internet. We have a website at the North American Spine Society, knowyourback.org. You can trust that site because it's unbiased. We give you the latest techniques and treatments that are available for back pain from a trusted source.
Joe and his doctor decided that he needed back surgery to restore strength and feeling to his legs.
What we did for Joe was to take him to surgery and take the disc out that was pushing on his spinal cord. That was a relatively simple operation with excellent results. Taking the pressure off of the spinal cord immediately restored his ability to move his legs, gave him his sensations back in the leg. And as we can see now, he's able to walk, he's returned to playing golf, and is able to lead a productive and healthy life.
The first meeting I had with Dr. Rao, I entered his office with a walker. 2 weeks after the surgery, I was back in his office for a checkup. No cane, no walker, walking quite well.
The most rewarding thing about being a spine specialist is my ability to transform someone like Joe's life and let him go back to being with his family, being a part of society, enjoying the things that he does, go back to his game of golf.
The North American Spine Society is dedicated to advancing the field of spine care. The North American Spine Society, or NASS, is made up of nearly 6,000 orthopedic surgeons, neurosurgeons, anesthesiologists, radiologists, physiatrists, and many others who work together to foster high-quality, evidence-based, and ethical spine care through education, research, and advocacy.
The North American Spine Society is dedicated to fostering quality spine care. We know that as a patient, what you really want is to be able to go into your doctor and trust that you're getting the best care and that you know that the advice that you're being given is the correct advice. We've worked very hard over the last few years working on ethics and disclosure, making sure that there's transparency, that you know that the advice that you're getting is really unbiased and the best advice you can get. We also take into consideration the latest innovations, and we want to make sure that you're getting cutting-edge care for your back pain. We also look at value, because value is important in this time where everyone's cutting cost. We need to not only look at quality of our care, but we need to look at how much that care is costing. So we look at our care as being the most efficient care, the fastest way to get you back to function and back to doing the things that you want to do most.
Thanks in part to the work of NASS, there are now more effective back pain treatment options than ever. NASS provides research funding and disseminates new information through a peer-reviewed scientific journal, the Spine Journal, and its annual convention.
We believe at the North American Spine Society that our members provide the highest quality care. We help them to do that by offering educational courses, workshops, and other ways of making sure that they are up to date on all the latest techniques and innovation to help diagnose and treat the entire spectrum of back pain.
Members of the North American Spine Society have access to a very vigorous continuing medical education program. We have research facilities, we have educational facilities that ensure that our members are equipped with the latest up-to-date knowledge base required to provide the best care for our patients.
Only a qualified spine care specialist can evaluate your back pain and recommend an effective treatment plan. For a list of experienced spine care professionals, visit NASS Patient Education website, knowyourback.org, to access their spine care provider search.
You can trust that if you go to the North American Spine Society website and to knowyourback.org, that you can obtain accurate information to help you with your back pain problem and help you find a doctor in your area who's a North American Spine Society member, a person you can trust to give you the best care.
If you suffer from back or neck pain, there is hope. Contact a qualified spine care specialist and get on the road to relief.